Are you already on Wikisana?
Dear viewers, welcome to today's format visit. Thank you for your time. Thank you also for all the numerous entries. And today it is such a small, I don't want to say collection, but the questions are very different. And that's why I would like to answer the first one right away. And that is from Dr. Fridolin. And then comes his last name. Dear Fridolin, you write to me that you are interested in following the visit programs. I don't know now whether you are a medical colleague or have a promotion for another field. But you write that you are now becoming aware or that we emphasize that root-treated teeth are harmful. And you think, would that actually be the case in general for all root-treated teeth, or should the corresponding teeth be removed instead? Of course, dentists also warn against tooth gaps, because it can lead to deep bone or tooth decay or tooth malformation. I'm a little confused here. Because I couldn't imagine having a pen tooth used. I see such an intervention much more difficult than a tooth gap. I'm 50. The question now arises about a root treatment or tooth extraction at the lumbar jawbone behind the corner tooth. Can a tooth gap also remain in existence for years without the follow-up problems mentioned by the dentists? Now, dear Fridolin, it is so that you can answer very, very broadly here. Because it concerns a fundamental problem. In a tooth, which root is treated? There is an extraction process that we start with. And every extraction process in our body is bacterially regulated. That means that the microorganisms contained in the root material of the tooth are now making an effort to remove this tooth. This results in highly toxic metabolic products. We are talking about scatol, sulfur, hydrogen, and ammonia. These are so-called corpse toxins. Thousands of dead teeth were put on a pile and looked at all the dead teeth and found the trilogy of these high loads. A dead tooth, which is in the area of the corner tooth, always has a reference to the corresponding meridians. This is the next thing that can be wrongly regulated again and again by a dead tooth, namely the meridian flow. This knowledge dates back to 5,000 years of Chinese medicine. That means that if I have a dead tooth on the stomach meridian tooth, which I identify as a so-called disturbance field, then you should pull this root-treated tooth. Also a logidictal meridian tooth, depending on the order. The physical situation is also crucial for this. If a tooth should be pulled or if a tooth should still have a certain repair. I keep seeing that root-treated teeth are overgrown. Then these are all things that I would not allow and do not want. This means that a root-treated tooth must be identified as a disturbance field. You can do this very easily by treating a tooth, by injecting it with procaine and simply observing what is happening. On the other hand, you can also test this kinetically, whether this tooth is a disturbance field. It is important, of course, that a tooth is not related to its impact on the human organism. For example, if I have 5, 6, or 8 dead teeth. Therefore, you may have to approach this issue a little more relaxed. I keep observing that a dead tooth also makes significant changes to the jawbone due to this bacterial infection that takes place there. Often, dentists send me intraoperative images, where we see what is actually a fact and reality in the context of these dead teeth for a defect in the jawbone. If you pull this tooth, then this means, and you have said this very well, that you could not imagine. I don't think you mean pen teeth, you mean now, when you pull it, that you then insert an implant. I would not recommend that at all, but first of all give this process some rest. It can be treated well with neural therapy, it can be treated well with ozone therapy. In order to give this whole healing process a nice and quiet time for it to reorganize. A gap is by no means a huge drama, what you can do with it. But you have to look at the whole concept, whether this gap can cause any change in the jawbone at all. It looks completely different again at the age of 50, as if I had to pull teeth at the age of 20. There are many people, and I also know a lot of dentists, who have teeth gaps at the back and say, no, I don't necessarily have to clean everything up. And this is a very nice, healthy aspect. At the age of 50, if a correction should really occur, you can really think of a bridge. The bridge also has 10 to 15 years of life. And that's how you actually go about it individually. But I would first have the tooth checked on a field of interference. And then decide in complete silence whether you can do a lot of good here through neurotherapeutic injections. Whether you can treat this jawbone process well, if it takes place. Or whether you can simply pull this tooth in the last consequence. But the last word has not yet been spoken at that moment. Personally, I would not hold on to a dead tooth at any cost. But I also want to admit that the body may be able to compensate this strain with support for a few more years. If, of course, there is an organ connection to a corresponding organ, such as in the front tooth area to the bladder, kidney, in the front tooth area to the prostate, and dysfunctional conditions arise, then of course it is clear that I would not hold on to that tooth. But in your case, if there is no other clinic anywhere, it can be a process that you can still think about in peace. I hope to be able to answer Fridolin with this. There are now an incredibly large number of book recommendations. For example, In aller Mund is a wonderful book that makes a lot of sense. In this moment, he has worked out many problems of the holistic dental medicine. There is a very nice book by Ernesto Adler, called Interference Fields in the Trigeminal Area, which may be less about dead teeth, but also makes it very clear how responsible disorders in the dentistry area are for human health. We doctors should also fully integrate this topic into our clinical view and in no way leave it exclusively to dentists. I think this is still too time-consuming, and we need to expand our training in this regard, both for human medicine and dentists. Both fields overlap here, and I think a very good cooperative collaboration could bring a lot of success, especially since almost 70% of all disorders in the dentistry area are largely responsible for an illness on a physical level. Then I have another email from Eva. Eva, you write to me, Dear Dr. Wiechel, I have been noticing for a long time that my hands and feet are falling asleep more and more often. That means they start to tingle and then they are almost as if they are emotionless. When I move them for a while, then it works again. I would like to ask you if you have any experience that such disorders could possibly be improved by an inospheresis, or how they could be cured. In short, I am 64 years old and I eat very conscious and healthy for many, many years. And I move a lot and try to avoid as much stress as possible. If that is possible. And I try to live more and more in a way that I actually feel good. But still my body is getting weaker more and more, even though I am aware that this is normal with an increasing age to a certain degree. No. You are 64 and I am 64. And I would not like that at all if my arms and feet fall asleep and you say that this is perhaps a question of getting older. No, it is not at all. And of course I would like to do everything to stay healthy and fit for a long time. That is a good approach, Mrs. Eva. You continue to write. You are from Austria and I would be very interested in thinking about an inospheresis. Are there actually good devices? Are there bad devices with which it is performed? How big should the distance between the first two inospheresis be? Is one day enough? How can I support the process? You continue to write. In medicine, in the natural sector, there is always talk of promising healing methods, such as the inospheresis, which are simply abused in order to earn money quickly and are treated very unkindly and questionable. So I assume that you would have read it in a way that someone would express themselves in this way. For my person, I never judge something I don't know. And people who talk about it like that don't know an inospheresis. Because the inospheresis is an extracorporeal process in which we filter 33% of the plasma from the blood. And this plasma is the liquid in us humans. The blood also has solid components, such as the red blood cells, the white ones, the blood cells. That's not what it's about. It's about the liquid. And this plasma goes through a special environmental double filter. That's new. And that was also essentially developed by Professor Straub. Professor Straub was a nephrologist for 20 years and was increasingly concerned when he was dealing with environmental medicine. My God, why do we always wait until the kidneys are really at the end? Why can't we focus on a diagnosis that shows us that even tomorrow our detoxification organs will be so heavily burdened that they will have to be dialyzed themselves? That's a little bit of the background, Eva. And that's why it's very hard to judge from the outside if you don't know what you're doing, which of course you can also achieve with it. You use inospheresis in conjunction with your hands and feet and falling asleep. And if you now mean hands and feet and falling asleep and tingling and deafness, if you would clarify everything with an inospheresis, then I would say not well invested. Because first you have to clarify the question why you have tingling hands and feet. And hands and feet are nervally supplied. And the supply of our hands and feet is given once by the nerves from the segment of the cervical spine and the feet from the segment of the lumbar spine. It's interesting, isn't it? If you move, let's say, if you move a leg, then it decreases. That means it's a muscular problem. And now I don't know anything about you. I don't know if you're a person who is also 64 years old, but does stretching, does fascia therapy, does yoga. What's it called? It doesn't matter. In any case, a therapy where you also stretch your muscles. Because if we even approach holistic thinking, then it's not just about having a holistic view of my digestion or my immune system, but also to understand what our musculoskeletal system needs. And in this moment, especially in the area of the cervical spine, there is a strong tension. And this strong tension of the muscles transfers over muscle groups. It can go down to your back. There are many causes that cause muscular tension. One can be that I'm very stressed. Now you write, I'm trying, no stress. I'm trying to live well and to eat and drink. But maybe it's a tension that you've learned to deal with. Maybe it's a conflict level with a friend, with an employee, with a not 100% relaxed situation. The life that feels easy, but also has a certain heaviness. Maybe there's a fear in your neck that you've been carrying for many years. But that's why you bravely master life. Maybe it's a burden that you carry on your back. Because you only deal with the modest things that are available to you. All of this causes tension. And if you turn to a thoracic therapist, then they know exactly in which segment of my spine, which psychological stress causes a tension in the muscles. In your case, I think it's very important to understand to go to the bottom of this thing. And the thoracic therapist is working on these muscle chains to bring this relaxation back into balance. There's a very nice book called How the Soul Heals Backache by Sano. And I think if you read that, then you'll have a very good access to this thing. What's also very important is dextrorotatory lactic acid. Whenever muscles are tense, there's a tension on the muscle capillaries. Those are the vessels that give oxygen to the muscle cell. But if the cell doesn't get oxygen, because the muscles are tense, then on a cellular level, the levorotatory lactic acid is produced. And you can neutralize this levorotatory lactic acid by dextrorotatory lactic acid. So please regulate the organic or just effective microorganisms. or ferment a lot yourself. Through our shows, Dr. Kitchen's Talk, we've done a lot of shows about fermenting. And it's a very simple, beautiful, and highly effective process that you should do. The fourth thing is, please make sure that the body gets enough magnesium. Because if it doesn't get enough magnesium, the muscles are tense. Magnesium is in a very large process with calcium. The calcium level in the blood depends on your vitamin D. So measure vitamin D, 1.25. Vitamin D, 25 OH. And also calcium. And then it's very important to look at the whole thing to see if there is a certain imbalance that provokes increased tension. Magnesium is the multi-talent of the cell. The body screams for sufficient magnesium every day. And it keeps the priority. Who needs this magnesium? And there are really other priorities than maybe the back muscles at the moment. The other thing is, magnesium can then be added in the form of magnesium citrate or magnesium glycinate. You can possibly dose higher. Make good magnesium chloride baths. Full baths. Warmth is very good. And maybe in this sense also a therapist. A neurotherapist, who, through procaine injections, can reduce the whole range of blood circulation, lymph flow, deacidification, through his procaine injections. Maybe also along the bladder meridian, from top to bottom, significantly improved. Speaking of bladder meridians, the bladder-kidney meridian is related to the four front teeth. Have you perhaps also had a root treatment there? Or now got an implant? These are also important things to consider. Because if there is a meridian blockade here, the symptomatic picture can be an influence here in the meridian course. And then there is an energy stagnation. So that would be very valuable information with your crutches and hands and feet, I think. Another note. The two Liebschabracht have, of course, an incredible number of exercise videos in their programs. And if this is perhaps a situation for you that you have not yet experienced, then you should roll out the mat every day for 20 minutes, 30 minutes, sit in front of your PC and do these exercises with Mr. Liebscher, which he has also catalogued very nicely. Here now the cervical spine, here now the knee joints, here the pelvic muscles. And in the context of this increasing muscular balance, the body is always the result of the adaptation to my life, whether physically or mentally. I think you get back into balance really well. And I think investing a little more there will have a significant positive impact on the whole thing. The other story is that, I'll come back to inospheresis now, I have the experience that we were allowed to accompany almost over 2,000 inospheresis. And I have to tell you, it has its own work, which, of course, is criminalized. To recognize causes of diseases. There was a rush. Also in the possibility of today. Accordingly and independently of one's own detoxification capacity and mobility, to remove things from the blood here. And I say blood, because we detoxify, or we filter the blood, of course. We clean the blood. But the body perceives this process and then pushes these toxins out of the connective tissue into the circulation. We can diagnose heavy metals in advance. We can diagnose them in blood in advance. But we can also do it later in the eluate, in this filtered plasma eluate. And that goes from bismuth to aluminum, magnesium, cobalt, gadolinium, gold, palladium, mercury, thallium, titanium, rubidium, vanadium, zinc, zinc zirconium. These are loads that we humans today do not perceive in any way. We can test parameters of pesticides, we can also test extensive herbicides. And we have the opportunity to filter the big question of the solvents of the benzoyl type, but also solvents of the alcohol and ketone type. On the other hand, the big question of halogenated carbons. And in recent years, the diagnostic development has made a leap forward. There is a book called End with Parkinson's, which I have already quoted several times from American colleagues, who as school medical neurologists say, how can it be that these questions do not come to the table, even today in an obligatory diagnosis, where we know that these organophosphates, that these solvents are also responsible for the development of neurological diseases. And if you take a disease in the sense of a stress caused by toxic things in the environment, then the inospheresis has given us a big lead to remove these things. Because we have intracellular, we have in the liver, no targeted detoxification possibilities to remove these things. That means we can only open up to release these organ loads ourselves, because we do that through the inospheresis. We clear the kidneys with it, we also clear the liver with it. Of course, these are essential as main detoxification organs. To bunk in themselves first. And this actually goes back to the whole study situation that is already there. That we see, as in the context of neurological diseases, but also many, many other diseases, here the chemicals of our present time significantly force diseases and create inequalities in an organism that takes over 10, 20, maybe 30 years to slowly reach a certain symptomatic level of disease, because its detoxification capacities slowly exhaust themselves. Sometimes these are also old loads from the past, which ultimately the body has not been able to withstand. So I would like to ask you that maybe in the context of your actual health problem, please not necessarily think of the inospheresis at the moment, but very gladly and comfortably think of a basic fast, as you write, whether I would support that, of course. But at the moment, I think, it is a valuable indication that sooner or later can and may be very, very effective in the context of a diagnosis in advance. But life may not necessarily depend on doing these things in your case. But maybe they will take place at a later time. Dear viewers, I am already at the end again. I was delighted to answer these 2 questions. I wish you a lot of nice things for the coming week, very nice, maybe also deep moments, and I look forward to the next visit with you. Whenever you have questions or need medical advice, I am happy to be there. Send them to Visite at QS24.TV. And for all the things that you can do, or that you wish to get more tips on, how do I do a lot of things daily in the kitchen, I can refer to Dr. Kitchen's talk at QS24.TV and all the really valuable programs that the channel has prepared for you, for all of us. I hope you will find it incredibly exciting to look at life from a perspective that makes you more aware, but also more aware in dealing with yourself, in dealing with life and understanding what life means in general. Thank you very much. See you soon.